Hello, and we are going back to basics today with rosacea. We'll go over a brief overview, then talk about the 4 subtypes. We'll discuss the possible causes of rosacea, the skin basics, meaning what does it look like under the microscope, what triggers a rosacea flare, and how do we treat this. And there's a lot of components to that, including lifestyle, over-the-counter products, prescriptions, and procedures. First, a very brief overview of rosacea. So rosacea is chronic skin inflammation, which causes redness and sensitivity. There's a very broad spectrum of presentations of this condition, and it affects about 5% of the population. It is more common in fair-skinned women between the ages of 30 to 50, and sometimes, unfortunately, we do miss rosacea in skin of color. Next, the subtypes of rosacea. There are 4 subtypes. The first, erythematotelangiectatic. That means red vessels. This type is when the skin is flat and it flushes very easily, and you can see vessels through the skin. The second type is papulopustular. That's basically very similar to acne. In fact, we call it acne rosacea. The third type is phimosis. That's thickened skin on the nose, and the nose may look enlarged. And the fourth type, ocular. That's when you have eye irritation, dryness, and you can have a gritty feeling in the eyes as well. So, can you have more than one subtype of rosacea? And unfortunately, you can. Here's a picture of a woman who has subtype 1, that flat redness you see, and she also has subtype 2, the more acne-type lesions dotted on the skin. Seeing subtype 1 and 2 are pretty common together. Now, what causes rosacea? And you'll see it says causes ? Because we're really not sure. It could be due to genetics. Rosacea does tend to be more common in people with Irish ancestry. It could be due to just blood vessel dysfunction, and that vessels are more sensitive to stimuli. It could be due to an overactive immune system because rosacea tends to be comprised of inflammation in the skin. Or it could be a skin-gut bacteria connection. It could be due to mites in the skin, which mites are common in the skin, but they tend to see more of them in patients with rosacea. It could be H. pylori, which is a bacteria that's associated with stomach ulcers, or it could be due to medications as well. Let's talk about the skin in rosacea and what exactly is going on. So rosacea is inflamed, sensitive skin. And what do we mean by this? So this is normal skin. We have a normal epidermis and dermis. We'll add the vessels. Those are normal in the fat and the dermis of the skin. And let's say through no fault of our own, let's say we have an Irish background and we just have inflammation in the skin, and this inflammation persists, and over time it turns the skin into this, which is an overgrowth of vessels to accommodate all that inflammation, and the very top layer of skin, it's really been damaged. Let's look at this again. So this is normal skin, and this is rosacea skin. So we see a lot of those vessels. We see the top layer of skin, it's very thin. That causes a lot of irritation in the skin. You know, when you put something on your skin and it burns or stings right away, that's because you have a very compromised layer of skin. It's called the stratum corneum. So how do we protect ourselves against this happening if we do have rosacea? First, we'll look at the epidermis. What can we do to protect this epidermis? Well, good skincare, good gentle moisturizer, gentle cleanser, sunscreen, and just really protect that very outer layer of skin. Next, we'll look at the vessels below. What can we do to delay the dilation and growth of these vessels? Well, it's hard, but the biggest thing you can do is just avoid your triggers so you don't have that flushing that comes with the triggers. Now, let's look at lovely Reba McEntire. As we all know, she is a single mom who works 2 jobs. And if you have rosacea, you also have 2 jobs. Your first job is to protect your skin, and your second job is to avoid triggers. Speaking of triggers, let's get into it. There are a lot of triggers of rosacea that could potentially cause you to flush. The first group, we'll talk about foods, things like alcohol, spicy foods, chocolate, coffee, some dairy products, or certain fruits or vegetables could cause you to flush. The next trigger, heat. So anytime that you're literally in a hot environment, hot weather, a hot shower, you're exercising really hard and you're more heated than usual. If you're in a sauna, All those things dilate your already dilated vessels, so you don't want to do any more damage there, so avoid the heat. Additionally, weather conditions, things like extreme temperature changes or a really harsh wind in your face can also irritate the vessels as well. Also, just good gentle skincare in general. We don't want anything irritating. We don't want anything to disrupt that skin barrier, that stratum corneum that we saw before. And also, anything that could flush you just by systemic reasons, meaning stress, embarrassment, medication, a medical condition. We just want to avoid flushing if possible. And next, treatment. There are a lot of factors that go into treating rosacea. First, let's talk lifestyle. So, protect the skin. We already talked about this. We know we have to really protect that stratum corneum from anything irritating. Also, avoid anything with heat. Use cool water to cleanse your skin. You can use a cooling agent like an ice roller if you're getting flushed. Also, a sheet mask, especially from the fridge, could be nice to cool you down, and also use a mineral sunscreen every day. Also, try to avoid flushing as you can, avoid any triggering foods, weather, stress, anything like that. When I was researching this, I saw a treatment option to avoid social embarrassment, and I thought that was so funny. Like, who goes out to embarrass themselves? Now, let's talk over-the-counter treatment options. These include things like gentle cleansers. These are a few of our favorites. Also, a few of our favorite moisturizers. The middle one, Aveeno Common Restore, that's my favorite in particular. I have no relationship with Aveeno. They don't know who I am, but I just really like their Common Restore moisturizer. These are also some good sunscreens as well. We like azelaic acid for rosacea. These are some good options, but azelaic acid does tend to pill, so it's best to use it at night. I wouldn't use it under makeup or anything. Other ingredients you can use: sulfur, it smells horrible, niacinamide, spring water especially to spray your face right before you put moisturizer on to really lock in that water. You can also use an anti-dandruff shampoo, ketoconazole, as a facial cleanser. Some people with rosacea, they get very flaky due to the excess oil production, and this helps to decrease that. Also, in the middle, this is a hypochlorous acid spray. It's a great antibacterial and anti-inflammatory option. Lastly, panoxyl. This is 4% benzoyl peroxide, and that can help manage mites in the skin. Panoxyl also comes in 10%. I wouldn't get the 10%. I think that would be a little too strong for patients with rosacea. Also, there are a lot of options as far as concealer and color correction. It used to be that we always said, oh, use green for color correction, but now the new thing on TikTok is using yellow for color correction. And you can see this TikToker here. I do think the yellow side looks good, but the green side, she used way too much of it, so that's not an accurate representation. Next, onto prescription treatment options. So when we're looking at prescribing a medication for rosacea, we're very much looking at the subtype of rosacea you have. So for example, the first subtype, that flat red type, we have a couple of options. There's Rofade and its cousin Mirvaso. These are a cream or gel that you put on every day, and they temporarily constrict the vessels. So for a limited amount of time, you won't look as red. The Rofade you can use every day. Another option we have for the flat red subtype, IPL and laser, which we'll get into later. Next, the acne subtype. This, we have a lot of options. And whenever a condition has a lot of treatment options, it means that none of them work particularly well, and you're just kind of trial and error going through different options until you find what works for your particular skin. The medications we use more commonly for this subtype, we like Soolantra, that's just ivermectin that kills the Demodex mites. Finacea, which is azelaic acid. We already know we can just buy azelaic acid over the counter. Metronidazole is a popular topical antibiotic. Also, Protopic or Elidel. These are what we call non-steroidal alternatives, which means they're creams that reduce inflammation in the skin, but they're not a steroid, so they're safe to use every day. A newer addition is Amzeeq. This is a minocycline foam. We'll get into doxycycline later, but this is its topical counterpart. And lastly, sulfur. It smells horrible. It comes in a lot of forms. It's antibacterial, anti-inflammatory, a good option if you can stomach the smell. Now, let's say you have a moderate case of acne rosacea and the topicals just aren't going to cut it. Well, then we look at pills. The pill we go to most commonly is doxycycline. It's a generic antibiotic. The most common side effect is stomach upset when you take it. If you do have that belly upset, you can switch to Oracea, which is the brand name of doxycycline. It's 40 milligrams. It's less likely to cause that stomach irritation. Oracea is for rosacea. I don't know why it took me like 8 years to put that together, but Oracea, rosacea. It makes sense. And for severe acne rosacea, we use Accutane. Accutane is a commitment. It has a lot of side effects. We have to do blood work. We see you for monthly visits. It's not our first go-to, but if the rosacea hasn't really responded to anything else, we do go for Accutane. Now on to the third subtype, Rhinophyma, or that enlarged nose kind of rosacea. This we deal with on a procedural basis. There's no topical that's going to shrink the skin. I'll link down below a really good example of how we treat Rhinophyma. If you do not like the sight of blood, do not click on that video. You should do the opposite of clicking on that video. But if you're interested, this is a really nice option to look at. And for the fourth subtype, ocular rosacea, this we treat with doxycycline, and we often co-manage with ophthalmology as well. And lastly, what procedures can we do for rosacea? And there's a few. First, we'll talk about pulsed dye laser, or PDL. And this is a laser that targets only red. So it's very good to target the vessels. The vessels collapse, and then you can't see them from the outside of the skin anymore. The actual procedure itself is pretty quick. You may or may not have numbing cream before, but the procedure, it feels like a rubber band snapping. Just a word of warning, you may bruise after the treatment, and this is a pretty typical course of what bruising looks like after a PDL visit. And onto IPL. What is intense pulsed light? Well, it is just that. It is a light. It is not a laser. What's the difference? So a light has multiple wavelengths. It's less precise, it's more superficial, and it's good if you have multiple concerns. If you have both redness from rosacea and you have brown sunspots, IPL could treat both of those at the same time, but you would require more sessions. In contrast, a laser has just one wavelength. It's more precise, it can penetrate deeper into the skin, and it's good for one thing. You need fewer sessions to accomplish your task, but it's only going to do that one task. If you have brown spots in addition to your rosacea, it's not going to do anything for those brown spots. You may have heard of VBeam. So what is VBeam? VBeam is basically the brand name of PDL. PDL is generic. VBeam is made by the brand Candela. So PDL, think of it as like a generic tissue. VBeam is Kleenex. What about peels for rosacea? Can we do peels? We can. They're not super popular. You might consider a Mandelic acid peel. It penetrates very slowly and evenly. It's non-irritating and it's antibacterial as well. So it's potentially good for rosacea.